how will the college be incorporating techs who are not currently registered with the associations and societies? Shauna, would you like to address that one?
I think it's something we have talked about. How do we deal with somebody who is an outlier from our association? And that is a great question. I think it's something that definitely needs a lot of thought. We need to take a look at possibly, have they just been off the association register for a short while, or is it something that they have been never on the books, etc.? And I think we could be looking for some at a grandfathering type of situation. We could be looking at making sure that somebody has at least done the national exam at some point, providing support, that type of stuff. Our goal isn't to get people out of jobs. Our goal is to make sure that everybody doing the job is appropriately trained and keeping patients safe while they're doing their job.
I think the bigger issue too is not so much individuals out there who aren't members of our associations, because we are voluntary organizations and we don't represent 100% of the technologists across the province. I think the issue is those technologists who might be working in the system who are not certified by the national organizations, which is the fundamental criteria for being employed here in British Columbia. There are individuals who out there who are referred to as qualified but not certified, and those individuals are working in the system. And we obviously will need to take a look at some form of grandparenting to deal with those individuals. The intent here is not to put barriers in place for people working in the healthcare field. The intent here is actually to make it easier for them, quite frankly, and to give more people more opportunities to work within the system. But I think grandfathering is certainly something that has been looked at in other provinces and has been incorporated as their colleges became a reality, and that's certainly something that we would be dealing with here on an ongoing basis as well. Again, the intent is not to put any barriers in place from people working in the system if indeed they're qualified and trained and competent.
The bottom line is keeping patients safe.